We're going to talk about breast sizing today. I think one of the questions that my patients struggle with the most is what size implant should I get for my breast augmentation? And I thought it would be nice to have an educational piece that talks about sizing in general and what things will help you and what things you should not worry about really. So we'll do a little consultation with a patient who's been sized by one of my coordinators, and we'll go to the room and talk about sizing altogether.
Hey everybody, my name is Ariana. I'm one of the coordinators here at Implant Cosmetic Surgery. I'm here today with our beautiful patient Alexis, who's interested in a breast augmentation. So we know that your current bra size is a 34B and you're interested in a 34 full C, maybe small D. We're going to go ahead and try on some sizes and you tell me what you think, okay? This is a 400cc. Now don't pay attention to the number. Let's just try it on and see what you think. Tell me if you would like to go a size bigger, a size smaller. So let's just go ahead and slide this on. And we can take a look in the mirror. And it's just to give you somewhat of an idea. You kind of can look to the side and see the projection. Okay. Would you like to try, I think that looks, you have a great frame. Would you like to try a size bigger? Yes?
Yeah, just to see.
Okay. So go ahead and leave that one in. This is a 450. Go ahead and try that one on. Okay, so what do you think? Which one do you like?
I think I like this one a little bit more. I feel like it fits my body a little bit better.
The 450, I agree. I think it looks great. As you mentioned, you like the 450cc. There's an exercise we like for you to do at home. So a 450cc would put you at about 16 ounces. So you can go home and find an old pantyhose. You can fill it up with birdseed or rice. Make sure you leave some room. Try it on with different bras, different blouses, and that way you can get a feel of what it is that you like. So the doctor will be in shortly. The doctor will come in, answer all of your questions, take some measurements of you, and once they're finished with you, I'll come back and get you.
Hello.
Hi.
Hi, how are you?
Good, how are you?
Excellent. I'm Dr. Haiavy. Ariana told me a little bit about you. So you've been thinking about breast augmentation for a while.
Yes, for a couple years now I've been thinking about getting it done.
Excellent. And you've done some research, you know the difference between saline and silicone implants?
Yeah, a little bit, not a whole lot.
Okay, I'll talk to you more about that and we'll do some sizing today. I see that you have sizers in place already.
Yes.
Excellent. Is that the size that you're liking right now?
Yes, I think so. I want to go a little bit more natural. I don't want them to be too big for my body.
Okay, sounds good. Let me take a couple of measurements and then we'll talk about all of those things.
Okay.
All right, let's have you stand up. Okay. So let's see. Your band size is about 36, and with these sizes in place, you go to almost 39. So this will take you up at least 2 cup sizes, maybe 3.
Okay.
As you know, cup sizing is arbitrary, right? Every store makes up their own cup size. I'm sure you've been bra shopping. Victoria's Secret is always a little bit larger than other manufacturers. That's their secret, by the way. So they make people feel good by going a little bit larger. So what cup size do you wear now?
So right now I'm about a 34B.
34B.
Yeah.
And you want to be?
I want to be like a full C, small D.
Okay, so with this implant you'll definitely be in the D cup region.
Okay.
And if you go to Victoria's Secret it will be a double D, just because they measure a little bit larger.
Yeah.
So the most important thing about breast augmentation is the look, right? What you want to achieve is a certain look, and it's very personal, and I'm sure that you've been thinking about this for at least a couple of years, if not longer. So what I want you to do is go in front of the mirror and look at yourself and tell me if you like the proportion, right?
Okay.
We want to choose an implant that matches your frame. We don't want to choose an implant that is beyond your frame and doesn't complement your hips or the rest of your body. So it's important that you choose something that matches your frame. So in order to make sure that we do that, I'm going to take some more measurements where we measure the breast width, as well as the distance between your sternal notch to nipple, and the distance from your nipple to the inframammary fold.
Okay.
Okay?
Okay.
And then we can talk about more things. You can take those sizers out. So these are about 450. Great. Let me just measure you without the sizers.
Okay.
So about 35 and a half. So 36 bra would be fine. And almost 37. So you would probably fit into B cup but not fill it all the way, correct?
Yes.
Okay. So just as a general rule, for every cup size, we need 5 ounces of additional volume or 150 cc's. So any implant over 10 ounces or any implant over 300 will give you the additional cup sizing that you want. But then after that, it's how much fullness do you want? How is it going to look on you? What kind of base width will it have? And those things we'll decide together. We'll help you decide, and I'm going to give you some homework. So your homework is to make sizers yourself.
Okay.
How you make sizers is you take a stocking. You're going to have to buy stockings, and either bird seeds or rice. And what you do is you're going to fill up the bird seeds or rice inside the stocking, and what I want you to do is get a measuring cup, and the measuring cup is going to have ounces on one side. You see that? And for you, since you like 450, I would start the exercises at about 13, 14, and 15 ounces. 15 ounces is the 450. Okay, that would be the upper limit of what you would go to.
Okay.
And try them in your bra, try them in your outfit. You can try them in a bathing suit. You can even go to work with it. You have to get used to them. You want to know what it feels on you. How much does it weigh? Also, you want to make sure that you're comfortable with the size that you're choosing. Okay, so try that. You let me know how many ounces you like on the outside, and then based on your measurements and the implant manufacturer's measurements, we'll choose an implant that imitates the same thing. In our paper instructions, you will see that it says that I usually go a little bit larger than what you like on the outside, especially if we're going under the muscle. And that's because when the implant goes inside, it feels a little bit smaller, so don't worry about that. I'll make that adjustment. I will go a little bit larger just to make sure that they look the same.
Okay.
Okay?
Okay.
Any questions?
That sounds good. No, I think you answered them all.
Okay.
Thank you.
Yes, you're very welcome. So that was a little sample of sizing with our patient. A lot of our patients get really confused about the different options they have in terms of sizing as well as implant profile, and they'll obsess about the number of cc's that they're going to get in their implants. But I just wanted to let you know that if you do the sizing exercises at home like we recommend, and you talk to your physician and surgeon and you work together, it is not really about the 5 cc's extra or 5 cc's less. As an example, I'm going to show you. Alexis liked about 15 ounces, which is 450 cc's. So I filled this measurement cup with 450 cc's of water. And what I will actually put in, based on her measurements, her breast width, which is the distance from here to here, from the outer portion of her breast to the inner portion, is about 13.5 centimeters. So I am actually going to put in Inspira full profile 485 cc's because we're going to go under the muscle. That's going to make her look like she has a 450 on the outside. So the way that we actually look at that is we take the patient's measurements and then we look at the manufacturer's measurements for the implant width. And we want to make sure that the implant that we put in you actually fits within your frame. That's what's going to make you look natural. And adding a few cc's or subtracting a few cc's does not make a difference. Here's an example. Here's the measuring cup with 450 cc's. This is a teaspoon of water, which is only 5 cc's. 5 cc's is just a few drops. That is not going to have an impact on your cup size. Even 15 cc's is not going to have a significant impact on the cup size. 1 ounce is 30 cc's, and you need at least 5 ounces to make a difference of a full cup size for a patient. So just to put things in perspective, you know, if you're thinking about 330 implant versus a 340, it's not a huge difference. But if you're thinking about a 350 implant versus a 500 cc implant, that is a full cup size of a difference. So don't worry about the sizing so much. Don't fixate on the numbers. Look at yourself in the mirror, you know, do the breast exercises with your partners, have fun with it. If there's a certain bra you want to feel, go ahead and buy the bra, make sure that there's not too much padding in it, and get your baggies and see how many ounces make you look the way you want to look. It's all about you. It's all about the type of result you want to achieve, and we'll help you get there and achieve the most beautiful, natural results that we can.